All right, so we're going to start here in chapter 7 where we're going to review the surface markings. This is going to help you with understanding what surface markings are named for, and also help you with learning them on the different bones. So we're going to be looking at a number of different markings. So the first thing we want to look at are depressions and openings, and the whole point of having these depressions or openings is passage of nerves, blood vessels, ligaments, and tendons. So if you recall, bones are pretty solid, and so we need, in order for nerves or blood vessels to pass through, we're going to need some sort of opening. So the first one here is what we call a fissure. A fissure is a narrow slit that's present. Some of the best examples of fissures are going to be your superior and inferior orbital fissures that are in the eye. So if you take a look here, you can see that these fissures located here in the eye are going to be a passageway for blood vessels and nerves. And a fissure is what we call a narrow slit. On the other hand, we have what we call a foramen. A foramen is a hole or opening, and it's going to be larger. Okay, so it's going to be a hole. And so here's an example of a foramen right here. Okay, this is going to be what we would call the foramen magnum, the biggest one. Just to the sides of each of those, you can also see some other foramen that are located here. Some are going to be larger than others. We also see that there's what we call a fossa. A fossa is a more shallow depression. A fossa is not going to be an actual hole, but it's going to be a depression. And so again, here on the skull, these little guys right here are going to be fossas. This is going to be where your mandible actually comes in and attaches, okay, to the skull. We also see that there's some fossas like on the scapula. This right here is called the glenoid fossa. It's going to allow for the humerus head to come in here. As well as on the humerus itself, down towards the bottom, you're going to see some fossas. Okay, so these little indentions that you see here in the bone are what we call a fossa. Another one we see is called a sulcus. A sulcus is a groove or furrow. And so in the humerus, again, there's a sulcus right here. You can see it. It's right here. Okay, this sulcus is going to be present between two elevated areas. So it's kind of like the valley. All right, and so this is considered a sulcus. The last one here we want to look at is called a meatus. A meatus is more of a tube-like passageway. One of the best examples of the meatus is going to be what we would consider the external auditory meatus. Okay, so we see that it's a hole on the outside of your ear, but it's going to travel through here. It's a tube. Okay, and it's going to have the internal meatus. Okay, so it creates a tube-like passage for your ear. The next one we want to look at are called the processes, and these are going to help form joints, or what we would call articulations. So one example is going to be what we call a condyle. These are going to be round knuckle-like projections or protuberances. And so again, on the skull, if we look right here, these guys kind of look like a knuckle here. This is a condyle. All right, this is called the occipital condyle. Also on the mandible, you'll notice it looks like a knuckle right here. This is going to be the mandibular condyle. Also looking at the humerus, if we look at the end right here, these are going to be condyles. Okay, they make a joint. This is going to be for your elbow. And then the femur has some of the biggest condyles. If you look here, see how they look like a set of knuckles right here? This is another example of some condyles. Another one that we see that helps make with articulations is going to be a facet. A facet is a smooth, flat articular surface. And so if you look right here on this vertebrae, you can see that this flat surface here is what we call a facet. This is where a condyle is actually going to come in. We then see that there's a head region on some of these bones. These are usually a rounded articulation, and they're going to be supported by a neck. And so the femur, again, is another great example of there being a head. So you see here you have the proximal head, and it's going to have a neck right here. Okay, so you have the head of the femur. You also have the head of the humerus. Okay, so here's another head of the humerus. And then the radius also has a head. So this right here is the radial head, okay, of the radius. Okay, so it gives you some examples. The next thing we want to look at are processes which tendons, ligaments, or either other connective tissue are going to connect to. All right, so it's going to be a place of attachment. And so an example of this would be a crest. You have a crest on your hip bones. So this is one of the hips. Okay, so this right here would be considered a crest, a large area for attachment, a prominent ridge. We also see some bones have what we call a spinous process. These are more of a sharp, slender projection, and you can see that right here on the scapula. Okay, so this sharp, more slender projection is a spinous process. Also on the vertebrae, we see that there can also be spinous processes. You can see them right here. Okay, they're projections off of the ends of the vertebrae. Another one that we can see that are projections are called epicondyles. Now, epicondyles are above the condyles, all right? And so if these are the condyles right here, these knuckle-like projections, these projections up here are the epicondyles, all right? So it's showing you a little bit higher, it's the epicondyles. Another example would be here on the humerus. This guy out to the side is an epicondyle right here. Okay, so it's a projection above the condyles, which are here. So it's an epicondyle. Now, again, some other processes that can help hold tendons, ligaments, or connective tissue are going to be like a trochanter. Trochanters are found on the femur. Okay, it's these projections right here. There's a greater and a lesser trochanter. So greater trochanter, lesser trochanter. Okay, these are very large projections, and these are only found on the femur. We also have what we call a tubercle. Tubercle are more rounded, knob-like projections. These are found on the humerus. Now, we talked about the sulcus already that runs right through here. These two mounds you see are little kind of mountains that make that valley. Those are what we call the tubercles. Okay, so on the humerus, you have these tubercles, and the sulcus runs in between them. The last one's a tuberosity, and tuberosities are a rough, bumpy-like surface that's found on the bone. On the radius, you see this bump that's right here. This is a tuberosity. Okay, so this is going to be a tuberosity. We also see on the hip, okay, on the coxal bone, this is a tuberosity. It's a rougher area right here. Okay, it's called the ischial tuberosity. And then we also have on the tibia, this little area, this bump that you see here is the tibial tuberosity. All right, so it's going to be a rough, bumpy surface marking on the bone.